Insurance Committee meeting to order of May 1st, 2025. Call the roll, please. Susan.
Commissioner Boyd. Here. Amber Brown. Here. Mike Curtis. Here. Holly Deering. Brian Gaither. Here. Mary Hickerson. Here. Lois Miller. Here. Commissioner McAdoo. Here. Commissioner Phillips. Jennifer Schmidt. Here. Michael Smith. Steve Spence. Here. Sonia Stevenson. Here. Eric Tutobeni. Here.
Thank you. Madam Vice Chair, have you had an opportunity to review the minutes of the previous meeting?
Yes, sir.
We have a motion to approve. Do we have a second? We have a second. All those in favor say aye. Aye. Opposed? The ayes have it. The minutes stand approved. Do we have anybody for public comments? Okay, thank you. Ed, financials, item 4 on the agenda, please.
Yes, sir. The Fund 264 you have for the month of March, you $2,406,156 in revenue, $2,557,704 in expenditures, for a difference of a negative $151,548. Your total for the calendar year 2025, $6,181,046 in revenue, $6,965,030 in expenditures, a difference of a negative $783,994. For the fiscal year 24-25, your totals: revenue $17,928,625, expenditures $19,983,311, revenue less expenditures, a difference of $2,054,684. For the 266 fund, for the month of March, you have workers' comp $655.09, OJI $79,620.49, for a total of $80,275.58. Year to date, you have at workers' comp $7,179.85, OJI $819,211.65, for a total of $826,391.50. And that is my report, Mr. Chairman.
Thank you, Ed. Any questions for Mr. Elam on the financials report? Seeing none, the chair will entertain a motion.
Motion to approve as presented.
We have a motion for approval. Do we have a second? Let the record show that Michael Smith has decided to join us. Any further discussion or questions?
I contributed.
Oh, man. All those we need a roll call vote.
Yes, sir.
Sorry.
Thank you. Commissioner Boyd.
Yes.
Amber Brown. Yes. Mike Curtis.
Yes.
Brian Gaither. Yes. Mary Hickerson.
Yes.
Lois Miller.
Yes.
Commissioner McAdoo.
Yes.
Jennifer Schmidt.
Yes.
Michael Smith.
Yes.
Steve Spence.
Yes.
Sonia Stevenson.
Yes.
Eric Tutobeni.
Motion is approved. Thank you. Item 5, OSHA report. Susan?
This report is for the month of March 2025. The total incidences for the month was 15. Of those 15, there was 11 at Board of Ed, 4 at County General. Of the 4 at County General, 1 was at EMS, 1 at PAWS, and 2 at Sheriff. That brings our year-to-date to 50, with 32 recordables, 5 lost day claims, 21 restricted day claims, and 6 other recordables. The reserves for the month was $98,740, which brings our year-to-date reserves to $256,635. Out of that, we have paid $47,778. 14 of those claims have closed. As of Friday, we had 6 employees that were out of work. 2 have since returned, so today we have 4 employees that are out of work and 16 unrestricted, and that concludes my report.
Thank you, Susan. Any questions for Ms. Thompson on the OSHA report? Seeing none, the chair will entertain a motion. We have a motion. Do we have a second? We have a second. Any further discussion? Seeing none, all those in favor of accepting the report say aye. Aye. Opposed? The ayes have it. The OSHA report stands approved. Number 6, the wellness report. Molly Howell, you're recognized.
For the current point accumulation period through March of 25, we've had a total of 1,564 wellness points earned and a total of 191 wellness goals met. That concludes my report.
Wow. Brevity is the soul of wit, ladies and gentlemen. Thank you. Any questions for Ms. Howell on the wellness report? Seeing none, without objection, we will approve. Item 7, Ms. Smith is not here yet. We're going to move Ms. Smith to the heel of the calendar. We're going to move to item 8, which is...
10.
You're right. We're going to item 10, which is Janet Cook with Prodigy Casualty Bids. Yes, my apologies. Yes, you're recognized. Let the record show that Ms. Deering has joined us. You're not the only one, Mr. Smith. Thank you for being with us. No, you're fine. Apparently there's some traffic issues, so we appreciate it.
Okay, good afternoon, everyone. We're here to talk about the property casualty insurance renewal. It's pretty straightforward this year. We did submit to about 15 to 20 different markets. All of the coverages that are being offered are your expiring coverages. We can go through those really quickly. For the building and personal liability through travelers, the premium is $3,635,712. The overall exposure is up about 11%. The rate increase is about 3.3%. The auto, general liability, public officials liability, and educators legal liability still is with Princeton. That premium is $983,985. The auto physical damage is still Hanover at $132,861. The vehicles were up from 885 to 934, or a 5.5% exposure increase. The values increased from $58 million to $60 million. The law enforcement liability is with Greenwich. Premium is $470,997. It's basically a flat renewal. The excess liability, which is over the law enforcement with Kinsale, that premium is $225,328. That is also a flat renewal. The dental professional liability is with Admiral at $7,430, also being a flat renewal. The cyber liability is Homeland Insurance. The premium is $50,450. That's for $1 million coverage with $100,000 retention. That is your expiring carrier. They also did quote additional limits at $2 million with $100,000 retention at $68,450. And then we had a quote from AIG that sits kind of in excess or over top of the Homeland Resilience quote. That premium was $49,700, and it's a following form, which means it has no deductible or retention. The crime is with Travelers, which is your expiring carrier. There was a slight reduction in premium there. That premium is $5,352. And then we had the firefighters volunteer accident and health with Provident. That premium is flat, pretty flat. It's at $4,204. Any questions?
Do you have any specific recommendations, since we have two options for cyber? Do you have any specific recommendation for that?
Yes, Ms. Miller, I do. We, of course, got some additional quotes this year, just as we typically do, if the markets will quote that. I know in talking with Mr. Smith and with the risk management department, I know that there's a lot going into behind the scenes trying to make sure the protocols are in place to prevent any type of cyber attacks. I would recommend staying with the current carrier and the current limits.
Mike, you're recognized.
I'm not sure whether this would be the appropriate place to ask this, and if it isn't, the chair could just correct me, and I'd be happy to go hide in my corner over here. Does this include any school board vehicles as part of the vehicle liability? No, this does not include anything with the school board. Okay, well, that answers my question then. Thank you.
So this is county-owned only, I think. Michael?
That's correct.
If you're asking about the third-party contractor school buses, this does not include that. But this does include school items that the school board and that the county owns.
Yeah, that was my follow-up to it, is if the school board decides to buy their own buses, we would be covering it underneath this, but this doesn't have anything.
With third-party contractors?
No, but I'm just saying, if they did buy school buses.
It would cover it, yes. And we would add to this policy as we add stuff every year.
Okay, cool. I just wanted to make sure.
Thank you for that clarification. Additional questions? Yes, Sonia, you're recognized.
So I just wanted to make sure I understood your recommendation. You said you would recommend staying with our existing carrier. Are you saying you would not recommend the additional coverage that's?
I don't think so at this point.
Can I clarify? I got a question. On the cyber, though, while it's the same carrier, didn't our SIR go down?
It did. Yes, thank you for mentioning that.
So
The expiring
I think we did
SR,
get better,
yes.
even though it's the same coverage and a lower premium, we actually got better coverage.
Yes.
I just want to point that out.
Yeah, the expiring SIR was $250,000, and they quoted $100,000, and actually the premium went down about $5,000.
I want to make a motion to approve the insurance bids that presented, but just to clarify that we would go with the existing carrier for cyber.
And that carrier's Homeland, so we'll put that in the motion too, if that's okay, Michael.
I'll second that.
We have a motion and a second. Further discussion, please. Mary, you're recognized.
I guess mainly just so that it will be out there and be said. This has all of our buildings that will be as of July 1st, 2025. So this covers the new elementary school that is being built, that BOE is having coming on board. So this is a 7/1 start date, and it will have all the new buildings and accessories within that elementary school.
Can I?
Yeah, I couldn't remember if it was on the schedule or not, but that is correct, yes.
Ed, did you want to comment?
Yes, to answer your question, yes. In what you're presented to you today would be as of July 1st, but that we also work with Michael's office for the other ones that are coming on, the additions, Riverdale, Oakland, and those. So then that amount will be budgeted at a higher amount whenever they come in, but we will put that in our price later on.
Mr. Kurz, did you have a question? Anybody else? Seeing none, we have a proper motion and a second, and we will do a roll call vote, please.
Commissioner Boyd? Amber Brown? Mike Curtis? Holly Deering? Brian Gaither? Mary Hickerson? Lois Miller? Commissioner McAdoo? Jennifer Schmidt? Michael Smith? Steve Spence? Sonia Stevenson? Eric Tutobeni?
Motion passes. Thank you, Ms. Cook. Ed, we're
Yes, sir.
still waiting on.
I think we'll attempt to move along, and
Well, why don't you advise the chair on how we're going to do that, since she was supposed to present on items 7, 8, and 9.
I will try my best to work through this ourselves.
You are Plan B.
Well,
You're recognized.
we are Plan B. So for item 7, you see we went out to bid for long-term disability. We also went out to bid for life insurance. You have a summary in front of you, the ancillary benefits for 2026 through 2030. We had several individual where they only bid life or short-term disability. Or they only bid the life, they only bid the long-term, or they only bid the short-term. And then what we did was we had Gallagher group them together and figure out package-wise in pricing, which one worked best. And a lot of the pricing was very, very close. But then the other thing you look at is what about the disruption to the employees? And by putting them all three together, the long-term disability, the short-term disability, and the life, what that would cost, and the best package that we pulled together, and you can see it in your recommendations and your summaries here, that to go with standard on the long-term disability and to also go with standard on the short-term disability and to also go with standard on the life. If you look at your summary, you can see where the rates went down, which is, I think Michael's already got it plugged in on the life insurance going down in the budget. So, you see a lower rate there, and that's one of the reasons why we're recommending standard. And I'll try to answer any other questions that you might have. I will say with standard, we do have a good relationship with them. We've had a good working relationship with them, and they are our present carrier on the long-term disability and the short-term disability. MetLife is on the life insurance, but we've had standard before, so.
Ed, for the sake of the minutes, can you summarize the recommendation for the ancillaries bid, please?
Our recommendation is to, based on the information that you have in front of you, is to, for long-term disability, short-term disability, and for life, to keep them all together in with the standard.
Thank you. Mary, you're recognized.
Okay, thank you. In looking through the notes and everything here, it looks like that the standard, if I look at them correctly, has a 3-year rate guarantee on all 3 items, long-term, short-term, and life. So that's a good deal. And having standard be with the long-term and also short-term, it makes it easier for the process moving from a short-term. Got that company doing that. I would like to make a motion to accept this recommendation, but I believe we need to determine what amount of life insurance we want, because I noticed that the bid was an increased life insurance. We got a bid for the $35,000 we currently offer our county employees. There was a bid for $50,000, and then a bid for like 1 times something of your salary, 1.5. So I don't know how we want to do this. If we want to make the motion to go ahead and increase the life insurance to $50,000, see where that goes before we vote on all 3. That when we vote on all 3, we're voting on all 3 with the $50,000 increase. How does the chair or committee want to do that? One big motion that we change to 50 and accept all 3, or do 50 first and then what's the will of the?
The chair's at the will. The chair's at the will of the committee. I don't think it matters one way or the other. I just think we need to make sure we understand that process.
What do we need to do to make it go to budget seamlessly?
That's Michael. Let me jump in here. Michael.
Okay, for the sake of everything, I make the motion to go with $50,000, the increase from $35,000 to $50,000 for our active employees for their life insurance.
Ed. We have a motion and a second. We're still under discussion, though. Ed.
Go ahead.
Michael Smith, you're recognized.
So do you want to pass what they've presented, what Ed's recommendation is?
Yes, because the figures are with the $50,000, because it really is not that much more to the policy, premium.
Is your recommendation to approve the renewal of standard at the rates presented, and that take us to the 50 that you wanted?
Yes, on your first page where you see recommendations, place life, LTD, and standard with the standard, you got the $50,000 on that first page, and you also have under STD add an additional option of 30/30 elimination period, option for employees to provide a lower cost choice for STD participation, but keeping the existing 0-7 option as well.
Mary, it's going to be easier to do it all in one and approve the insurance department's recommendation as presented.
Okay, I can do that. As recommended, LTD, short-term disability, and with life at standard with $50,000 and the 0-7.
So we're going to
I will withdraw my first motion on changing the life.
That is the third motion we've had on the floor. So we're going to get some order in here, guys, okay? So what we're going to do is, Ed, you made a recommendation. There was no motion on your initial recommendation that I asked for or second. So you made a summary motion, and we have a motion and a second. You're withdrawing that motion, correct? The first motion, okay, so that motion is withdrawn, and now you're going to make a final motion. This is the final motion. And Mary, state your motion so we can have the proper second.
Okay, the motion is to go with the insurance director's recommendation for life, long-term disability, and short-term disability with the standard. With the life being moved from $35,000 to $50,000, and the existing on the short-term disability to stay at the 07 option.
We have a proper motion, Ed. I will wait for the second. We have a second. We will now have discussion. Mr. Elam, you are recognized.
Well, also included in that recommendation is to add an additional option of the 30-30 elimination, to where if someone could pick the 07, somebody could pick the 30-30 if they have days built up. So that's also our recommendation. But Marissa Combs is here.
Hold on a second. If you'll let the chair
I'm sorry.
be the chair, we would appreciate it. Thank you. So we're going to finish this unless the committee would like Marissa Combs to come up and finish this. I think we're close to finishing item 7 on ancillaries. We have a proper motion and a second. Is there further discussion? Would the committee prefer Ms. Combs-Smith provide additional explanation? Seeing none, call the...
Can I ask a question?
No. We have a proper motion. Michael, did you have a question? Is there any objection for the question? Seeing none, call the roll.
Commissioner Boyd. Yes. Amber Brown. Yes. Mike Curtis. Yes. Holly Deering. Yes. Brian Gaither. Yes. Mary Hickerson. Yes. Lois Miller. Yes. Commissioner McAdoo. Yes. Jennifer Schmidt. Yes. Michael Smith. Yes. Steve Spence. Yes. Sonia Stevenson. Yes. Eric Tutobeni.
Motion passes. Thank you, committee. Now we'll go to item 8, and we'll have Ms. Combs-Smith come forward and present item 8, the 2026 health rates. We're really glad you could join us.
At this point, I'm just grateful it wasn't night on I-40, which is where I'm supposed to be later. So it turned out fine.
We're good. Thank you.
My Uber was prompt, thankfully. Good afternoon. Thank you for bearing with me while you got through your ancillaries with Ed's assistance. We will be back. I don't know if you shared this, but we will be back on the 29th of May to go through the couple of other plans that are still under evaluation on the ancillary side. So turning to Medicare Advantage. I kind of ran, so I'm out of breath. I apologize.
No, take your time.
No, you're good. I can go.
We're on the health rates.
Yes, sir.
And we're not in a rush.
Okay, health rates. All right. For the health rates this year, we recommended that you definitely pass an increase. The overall health of the plan needs it. Some of the later or the more recent projections that we've run are actually showing a need for significantly more than what we're recommending right now. That's because we don't know what the overall trend is going to be based on, it was doing really well, and then it kind of hit some increases that we aren't necessarily surprised by, but we would like to watch for a little longer. So for that reason, we recommend a 6% increase for 2026.
We have a motion. Second. We have a second. Is there any further discussion? Why, of course there is. Ms. Hickerson, you're recognized.
Actually-
I apologize. I really meant that as a
no.
fun gesture. It came out really poorly. My apologies. You are enthusiastically recognized by the chair.
No, that's okay. Really, the purpose of this right here is, and I say it often, and I've said it in other meetings, we talk about a 6% increase. And I often say that my guys cannot take 6% and go to the grocery store and get a loaf of bread, but if you tell them it's $2, they know how much they got. So with that being said, mainly, I was going to ask you, but I since figured out on the chart of one of our exhibits, basically the 6%, if you take our richest plans, which is the open access, if you're employee only, it's going to only increase $5.40 or 46 cents. If you're on the copay plan, and the copay plan is only going to go up $31.69 if you're employee plus family. And then if you go to the high deductible plan, if you're still on that open access, which is the Cadillac version, employee only gets a $1.66 increase, employee plus family gets $9.64. So when you say 6%, it sounds like a lot, but at the most, of course, we have a few over here on the deductible plan, but that's, I had asked earlier, and it's 25 or less people on that plan. So really, our employees are going to, at the most, if it's the Cadillac plan, employee plus family is going to have less than $32 on increase on a monthly premium for this 6% increase. So really, it's just a FYI, and to get it out there for folks to realize 6% is less than $32 at the max on your check.
Thank you, Mary. Any other questions or comments? Seeing none, call the roll, Susan.
Commissioner Boyd, Amber Brown, Mike Curtis, Holly Deering, Brian Gaither, Mary Hickerson, Lois Miller, Commissioner McAdoo, Jennifer Schmidt, Michael Smith, Steve Spence, Sonia Stevenson, Eric Tutobeni.
Motion passes. Thank you. Item 8, Medicare Advantage. Ms. Smith?
Now I'm back on track. So for the Medicare Advantage, just kind of to remind everybody what we're talking about when we talk about that plan, because there are several things about a Medicare Advantage plan that work differently from active employee insurance. So our process to place that coverage was to issue a public bid. It's a 3+1+1 possible contract. But the Medicare space right now is unpredictable, somewhat, subject to governmental regulation as well as variation in how it's going to pay for various services. And then there are all kinds of other things that go into an annual evaluation on the cost of those plans that are done by a call letter, is what it's called. And that issues typically in April. You'll get some preliminary information earlier. As it turns out this time, the preliminary information wasn't as favorable as the final information, which it does explain some things for y'all. But the final call letter issued on April the 7th. And so we were running the bid process very clearly from the beginning with a initial deadline, a best and final with finalists. That the finalist meetings occurred between the original deadline and the best and final deadline. And then we had that best and final deadline actually last Friday. We saw both rate improvement and plan design improvement from this bid process, which is very good. The two finalists that we narrowed it down to were Humana and Cigna, your incumbent that has since announced a divestiture to HCSC. HCSC is a abbreviation for Healthcare Services Corporation. Healthcare Services Corporation is a 5-state organization owned by Blue Cross out of another part of the country. That's not bad. I don't tell you that for an unfavorable reason. There's nothing wrong with that. They've just acquired all of Cigna's book of business on this topic of Medicare Advantage only. When I say they've acquired the whole book of business, what I mean is they've acquired the systems, the people, literally the whole book. So everything it takes to run Medicare Advantage is kind of how we think about it. I don't really know of an exception to that based on our discussions with the HCSC representatives. That transaction was effective in March, so it's final. It's certain. There's no speculation there. And all of those employees of Cigna, which is roughly 6,000 according to what they've communicated with us, from the Medicare Advantage section have moved to HCSC. You've probably noticed from the document that we gave you all as an exhibit that upon evaluation of the two carriers that were finalists based on a variety of conditions that we gave you quite a bit of backup for, but I'm happy to explain anything you have questions. Change is happening either way. While the change is not necessarily the people who service, because at this point, what we know is that Cigna's entire team went to HCSC, which is good. That's continuity. So for the rest of this year, for example, the same people for sure in place, and for the foreseeable future, there's no clear intent to leave from anybody. So the service team members apparently would be the same, but the portal that your retirees log into is changing, and the brand, the Cigna brand, is changing to HCSC. So employees under either choice will see change. There's no silent, disruption-free option, I guess is what I'm saying. Arguably, the disruption is really very similar, except as to the natural questions anytime you change carriers, like, what are my prescriptions going to do? What are my visits going to look like? Who are the vendors that I can see? So we did a very careful evaluation of those items, and I think, at the end of the day, I put things in your packet, which again, I'm happy to go through in whatever level of detail you'd like, but we feel comfortable, and I think risk management feels comfortable, that the Humana option is not really a network disruption in a meaningful sense because of the way Medicare Advantage works. So they bill Medicare, even out of network, bills Medicare unless they draw a line in the sand and the provider says we absolutely won't, which is pretty unusual. In addition, the prescription piece, while the MOOP is different, that's the maximum out of pocket. Under the Humana plan, it would move from $1,250 to $2,100. That sounds like a lot, and it is. But they've got plan design alterations on some other benefits that would close that gap pretty significantly for every member, as opposed to just the members that need the medications that would drive a higher spend. In addition, Humana has placed a $0 copay on Tier 1 and Tier 2. So when we analyzed all of the prescriptions, you might say, well, what's the bottom line? The bottom line was that there were about 2,000 claims historically from our last year's claims that would fall outside of that $0 copay, and around 20 to 21,000, the exact number I think is in your packet, but that would fall in the $0 copay. We don't have that on a member-by-member level. So you have around 600 people in the plan. I don't know, as I stand here in front of you, if there are 5 people who would be on the MOOP issue that we're talking about, or if there are, 50. I don't know the answer to that, but what I know is in total claims over the last year, as a snapshot, roughly 2,000 of those would be outside of that $0 copay. There are 2 pharmacies that are currently, quote unquote, out of network, but again, remembering that they could still choose to bill if they want to, and they could still choose to join the network. And we have some pretty extensive efforts that will go into place to try to do that. Those 2 pharmacies are WellCare Pharmacy in Murfreesboro, which is associated with WellCare Health Plans. They offer Medicare Advantage and Medicare Part D prescription plans, I think on an individual basis. I really don't know that vendor. Nipper RX is in Charlestown, Indiana, and it's a retail pharmacy, but that's where apparently one of your members has had a claim filed. So based on all of those things, we then turn our attention to price. Throughout the bid process, Humana's price was extremely favorable. In best and final, both carriers submitted lower prices, so it's not like one did and the other didn't or anything. They both had the opportunity and both did take advantage of that. The final pricing difference, though, is around $30 a plan per member per month. So Humana, the recommendation that we're making for the plan that we suggest is improving on the price by around $30 per member per month. That feels significant, but turning our attention to what the bid required that we look at several areas, and there were points assigned to them. So in your exhibit on page 6, there's an executive summary, and it outlines the point allocation. On the point allocation, you'll notice that plan design was always weighted the heaviest. Humana's plan design is an improvement in several areas. The dental benefit is $250 per member per year, up to, not automatic, but up to. So when they go to the dentist, if they've purchased your county policy for dental, they can still take advantage of this policy. Medicare does not coordinate benefit like a traditional active employee plan. We asked that question. So for that reason, that $250 improvement on the dental is something that they didn't have before that they do under the Humana plan. I consider that a plan design improvement. Another one is hearing aids. That one improved to $2,000 in coverage every year, up to. I mean, again, not guaranteed money, just if they need it. And then vision was, I believe, a slight improvement, maybe $50. I'd have to remind myself a little more detailed. Not worth a lot of attention. And then there was a podiatry improvement as well that I called out in your exhibit. So plan design features that help your members as they age and need those services. So that was that 35-point category. Under the experience and financial condition and all of those, I think that that's, somewhat in the eye of the beholder, I would say, because we have every reason to believe that Cigna's divestment to Healthcare Services Corporation will and should go smoothly. Every reason to believe that. But that's a new owner and a new day, and we don't know. And so I don't know that you placed just an undue amount of attention either way on that, but I do think I should point it out. It was a high point value in our weighting. And then finally, the cost. So at 20 points in terms of our weighted allocation, that $30 spread per member becomes pretty significant. So for that reason, we recommend that you choose Humana's option. That's their enhanced option. That's the one that carries with it those extra benefits and is still $30 or so, just under $30 cheaper per month per member.
Recognized.
Marissa, can you let everybody on the committee understand what Retiree First is and
Yes.
how they interact with both of these carriers, and which one of the carriers would you feel embraced the use of Retiree First?
Yes, thank you for that. I appreciate you giving me the opportunity, since I did not catch that note that I did have there to remember to speak to it. Retiree First is what I would consider a partner in Medicare Advantage. Not only a team of folks that I trust in my role, but I think, we vetted them within Gallagher with other brokers that are in other markets and have used them. They're a nationally, footprint company that sits in conjunction with the plan. So when we went to market, I had a pre-bid meeting with risk management and went through, this is an option. You certainly don't have to do it, But I would like for the bid process to prove that the pricing with their assistance is the same as the pricing without. And you might say, well, that sounds too good to be true, Marissa. What are you saying? But the bids came back. Option 1 column was without retiree first. Option 2 was with them. And when Humana presented their option 3, they put with and without. You know, we knew what the cost was going to be, and there's no load for having them. So the question is, do we need them? What do they do? I believe that they will be an enhancement to your program because they're going to partner during implementation and during service to create another pathway for help for your retirees. So in addition to the wonderful work that risk management does, and I know Corinne spends a lot of time with retirees, she still will be able to do that. Risk management will still be able to do that. But when those phone calls come in or somebody walks in their office and they need to understand how to file a claim, their provider says that we need some help knowing what to do, well, then she can call and get on the phone with the retiree first and immediately cure that, you know, through a series of processes. One of the other helpful things is that they have a call center that exceeds normal operational hours of risk management, so that if someone needs an answer quicker or, you know, something like that, that's available to them. And those call centers have visibility system that helps them have visibility into what your individual retirees need based on their own personal conditions and things. So it's a neutral, not risk management employee who, if they want to, they can talk with and say, hey, I've got to go see a podiatrist, what do I do? And then they'll just walk them through exactly how the coverage is going to work, what's going to happen. And then if there's something they have to check on and call them back, then they do some things and then call them back, and all these things are logged. The reason the carriers are happy to include them is because they help them increase their star rating. So the Centers for Medicare, the abbreviation is CMS, Center for Medicare and Service, I don't remember now, but that center that issues the call letters and things, they also provide the star ratings, and those types of things are affected by customer service, which then affects what they get reimbursed, and so it's to their benefit to have an increased customer service, which is why the partnership works. I don't know if that's the depth you wanted, but yeah.
And I mean, I can figure this thing out, I never can. I was fortunate enough to sit in on some of these meetings where we were talking to the carriers, and Retiree First was engaged in these meetings, and they came across as caring individuals who really embrace the role of helping the post-65 retiree with these kind of issues. And one of the things that I noticed was one of the carriers embraced them wholeheartedly and was excited to have them on board. And because one of the points they brought up is when a retiree calls in and Retiree First answers the call, then the next time that retiree calls in, they make every effort to move that retiree back to the same person that they talked to the first time, which again adds continuity to the plan. And one of the carriers embraced that significantly. The other one, when they were on, I asked them who would they want them to call, and they said they wanted them to call the carrier, which means they would talk to somebody different, more than likely, every time they called in, and it would put the work right back on the people in risk management to handle these questions.
Yeah.
So
she had asked me to clarify that. I will answer the which carrier. That affected our thought processes in sense of the customer service, and Humana wholeheartedly embraced it. In fairness, the bid numbers reflect that both carriers do. I think it might be a transition element of not totally knowing what philosophies are going to be part of a new regime, 6 months from now. I think there could be some of that happening, but Retiree First has worked in markets with both with success. So I don't want to, make it too large of a point, but.
Mr. Tobini, you're recognized.
Thank you. Actually, I have several short questions. So, Retiree First, both companies are willing to work with them, are you saying, or only Humana?
Both have indicated by their pricing and equivalent pricing.
Setting the $30 per month aside, with both carriers, what is the cost to see primary care doctor?
Well,
Zero?
yeah, it's
Zero cost?
Medicare reimbursement rates, so it's exactly what it would be the same under both providers, yes.
With both carriers going into the hospital, is it the same daily rate?
It is all of it is based on Medicare reimbursement rates.
Okay, because I didn't see, as I went through the material, I didn't see an outline of coverage. And there wasn't a formulary either.
Okay.
It was just a whole bunch of numbers, calculating price against price, but I really like to look at value against value. Like going out of network, what would the cost difference be? Going to a walk-in clinic, what would the cost be? Staying 5 days in the hospitals versus staying 30 days in the hospital, what would that be? Seeing the primary care doctor, seeing a specialist, none of that was in any of the material.
I see why that could be confusing. Both plans are identical on those points. The only improvements above what your current coverage exactly is right now, which is, again, based on Medicare reimbursement rates and plan design, the plan designs are the same as what your employees have right now, with the exception of the improvements that I call out and the one decrement of that MOOP change, the maximum out of pocket. I think it's really important to remember that in Medicare, network does not work the same as in an actives plan, meaning there was only one carrier out of the entire bid process, and it was Blue Cross Blue Shield of Tennessee, locally, so the Tennessee one, not the one that owns Cigna's block, okay? They're independent of each other. But the one that was local, they have Vanderbilt will not accept billing from Vanderbilt. It's like clear cut. So for that reason, that's a huge network disruption. We didn't even think about it. But from the rest of them, there's no declining to bill or anything that would prevent them from properly filing a claim.
Yeah, when it comes to Vanderbilt, Vanderbilt's kind of mean. They kick companies out, and they're very disruptive about that. And I don't put that on the carrier, I put that on Vanderbilt, because I've dealt with Vanderbilt for years. I don't like them. But anyway, getting back to these two options here, I was going to ask you about networks next. The Physicians Network, are they PPOs or HMOs? I'm assuming they're both PPOs?
Yeah, they're both. I don't want to speak out of turn. The difference in that in the way it's applying to Medicare Advantage, I did not, specifically prep for that question, but I can tell you they're identical in what they're using to the existing.
Then what about hospital networks? Is that identical as well?
For these two, yes.
And
if we had Blue Cross at the table, no, but.
And assuming then that Vanderbilt is in network with these?
Yes, yes, there is a, I thought it was in here, and I think it maybe is not. So I'm trying to see this on your chart.
Vanderbilt, St. Thomas, Stonecrest, those are the main ones that Rutherford County deals with.
Right. We did a check we used your claims and then checked providers and actually had the carriers themselves report back those items rather than us speculating. So when we did the network comparison, we used carrier-provided information around network. But again, remember, network is a snapshot in time. I think that's important, but it's also less consequential in Medicare Advantage because of the fact that you can go to an out-of-network provider as long as they're willing to bill Medicare. They may not have a contract through Humana to do so, but if they're willing to bill Medicare, they still can see that patient.
Okay. Thank you very much.
So the chair's going to take a small privilege here. I really appreciate Mr. Tudabini's knowledge base and wisdom and passion for the subject, as I do all the members of the committee. But I would just a bit of caution when you speaking derogatory maybe about a provider or carrier our personal comments, we need to be careful about those comments. This is a policy board, and what we say absolutely does matter. So while I appreciate the enthusiasm of your comment, I would caution the rest of the committee to be careful when weighing in about a healthcare provider. Somebody else wanted to be recognized. Oh, Ms. Okay, great. Thank you. Ms. Stevenson, do you have a question?
I have a couple, just to make sure that I understand. So when on the recommendation, it says for, you have one for HCSC, and then you have Humana option 3. When I look in the RFP review section, it has Humana Enhanced and Humana Standard.
Right.
Which is option 3?
And the enhanced.
The
Thank you
enhanced.
for that question. Yeah.
Okay, and then under Humana were the drugs, it goes from the $1,250 to, I think it's $1,250 to $2,100. Does the savings from including a tier 2 drug, so under the way it is now, we have tier 1. So if they're adding in tier 2 drugs, does that kind of offset to make the is that, even though the out-of-pocket goes from $1,250 to $2,100, does the savings that we're going to have adding tier 2 make up for that?
So I
maybe.
think, I think in fairness, it would depend on the member and their particular prescription. I mean, I without knowing what every single retiree's makeup is on what they take every month, I don't know at the member level how many people are better off with the $0 copay, but here's what I do know. 100% of your plan participants receive this additional benefit of Tier 2 being a $0 copay under the Humana option, whereas if they never exceeded the $1,250 MOOP anyway, you're paying extra premium for a benefit that is applying to everybody if they needed it, but it doesn't necessarily mean that's the utilization of the benefit. Does that make sense?
Yes. And then my next question is, I'm sorry, I've got several. My next question is, on the pharmacy buy-up section, does that mean that that's included in that plan, or does that mean that they can have a buy-up plan to include those items?
Pharmacy buy-up section.
About supplements. It
Okay.
talks about supplements
I want
and.
to make sure I answer your question correctly based on where you're at.
Let's see. I am on page 3, and it says includes buy-up of table, Part D supplies, insulin, oral injectables. Buy-ups include enhanced ED, vitamins and minerals, senior care, dental products. So on that buy-up, my question was, is sometimes you can have like a dental plan and then have a dental buy-up because you want extra. So I didn't know, is that how that will be handled? You have the basic and then they can buy up to have that additional?
It will, if you're asking, will it be handled at enrollment as an election that applies to the whole plan year for additional premium? No, that is not how it's working. It's more as it is utilized, there's an increased cost for those items.
Oh, an increased cost, okay.
Well, yeah, it's a uncovered benefit that if you're using it, you've got to pay something.
Okay, that's what I was asking, so it is kind of an increase. So one of the things that they also mentioned is that there's 2 pharmacies that were we able to determine who those 2 pharmacies are?
We were. It was WellCare Pharmacy in Murfreesboro, which is associated with WellCare Health Plans. I don't know if folks that don't have those health plans can use it. I don't know the answer to that. And then Nipper RX out of Charlestown, Indiana.
Okay.
It's a retail pharmacy, that one is, but, and I did find what you were asking about, the contracts and the provider contract piece as well. It was not on your screen, that's why I was confused. I have it in my notes, but if there is still concern about that, I did find it.
And then I think my last is more of a not a clarification, but agreement that I'm understanding, or just for the viewing audience. On the Humana, it has 2 pieces. One is the vision that has a $250 allowance. Will you kind of explain what that means so that people that hear that will understand that.
Yep. So the dental services, it's on page 3 of your packet in the green enhanced ancillary services, option 3 snippet. And you have 100% for comprehensive oral evaluation or periodontal exam up to 1 every 3 years, and 100% for panoramic film or diagnostic x-rays up to 1 every 5 years, and 100% of bite wing x-rays up to 1 set per year, 100% of emergency diagnostic exam, and other different tests up to, though, this is the important part, $250 combined maximum benefit coverage amount per year for all preventative and comprehensive. So the things I listed probably cost more than $250. But if you have one of those, then the claim can be submitted through here and you get an additional $250 up to, benefit there. So if a person also has your dental coverage through the county, we actually asked that clarifying question, and this was the answer from Humana. So stacking ancillary coverages for dental, vision, hearing, those types of things. Member enrolled in Medicare Advantage plan can also have individual dental, vision, or hearing plans without restrictions. Since these individual plans are not coordinated with the Centers for Medicare and Medicaid Services, there is no primary or secondary coordination of benefits between them and the MA plan. And furthermore, if they have both the MA plan and the individual plan from the same carrier, coordination doesn't apply because there is no formal coordination. So the provider can file the claim both places. Each plan will operate independently. And it's working like that on the vision as well.
So in our layman's minds, they can be stacked.
Yes, that's why I called it stacking, and then when they answered it, they gave me the formal answer. Yes, that's right. I think it would also be helpful on the pre-authorization on any prescriptions or anything. There's a retiree first service that's going to step in to help them with that pre-auth, and Humana is going to give them the 30-day first fill either way. So there's a process in place to make sure that we have a smooth transition on those as well.
Told a story. I do have one more question. On page 3 of the bid section, the column for where it says number of fully insured Medicare Advantage plans terminated in the past 24 months, and for Humana it has 111 versus Cigna, or it's not, it's the HCSC has 12. Or should we be concerned that they had 111 versus 12?
I don't feel concerned about that, because if you go up 2 lines, the number of fully insured Medicare Advantage plans they administered in 2024, that's the group-based plan, like what we're talking about here, not the individual coverages that people can go buy in a supplement market. They have a lot more volume as well. So Cigna has 65, Humana has 669. So the extrapolation doesn't feel off to me.
Sonia, were you done? Okay. Any other questions? Marissa, can you, Ms. Erickson, you're recognized.
Thank you. Okay, so guaranteed rates. I see that HCSC has a hold on 27 and a max cap of a 5% increase on 2028. There are no guarantees like that listed for Humana. I know when it has been brought up or talked about before, they're like, well, we don't know what HCSC is going to do now that they've bought Cigna. But we can only go off of what is on the piece of paper in front of us today. Because honestly, everybody has a price. So somebody can come in and buy Humana also. And then we have this, I don't call it disruption, but it could be a disruption. But we need to remember, since Humana doesn't have any kind of guaranteed rate, they'd be crazy if they took a huge increase in 27 and 28, but we don't have it on a piece of paper that they can. So just kind of saying that for that. And then, there may be more later, but we were looking at the price, and yes, there is a significant difference between Humana and Cigna by that $30, but that's not going to be $30 completely absorbed by the post-65 person. Rutherford County, in their wisdom, when all of this was set up many, many years ago, there are employees that are grandfathered that the county picks up 50% of their, on retirees, 50% of the premium. And, you know, like for me, I pick up the 50% for my department retirees. And then when we had to draw the line in the sand, we said 75-25. So the max of the 50% is only going to be $15 to our employee retiree. Okay, so with that being said, in January of 22, I had an individual paying $303 for a plan. Then he got a nice when we went to the Medicare Advantage. He is only paying $102.38. All right, January of this year, he would be grandfathered in at $130.50. So we got to keep in mind that this is still, even if we go with the Cigna 1, 2, 3, whatever the options are that you recommended or could recommend, it is still cheaper than what they were paying. And I've said it in other meetings, and I'll say it again here. We have to remember that this county and the quality of our employees and departments were built on the back of our retirees. So with that being said, there are people on my retiree list. I've been here 30 years. There are some widows on here that was there when I started. So we have to remember 30 years ago, we were not paying these employees much of nothing, but they kind of had a guarantee, but not really, but a handshake kind of thing. We'll take care of you because we'll have your retiree insurance. So we got to remember, we don't want to take nothing away from somebody who worked a long time to get what they've got. And the new people, new kids, the whole everybody new that's coming in to Rutherford County being hired, they know where they stand when we hire them, that you will or will not have this benefit as a post-retiree, post-65 or whatever. But we have to remember, we got to take care of the ones that have earned it and are still working to earn it, and the ones that are already owned it. Thank you.
If there are no more questions, I am going to ask Ed to help formulate a motion so that we can have a proper motion and second, or recommendation so we can have a motion.
Mr. Chairman, the Risk Management Department recommends Humana Option 3 at the per member per month rate of $220.28.
We have a motion? Second. We have multiple seconds. Wonderful. Mr. Gaither, did you want to be recognized? Are there any questions? Amber, did you have a question? Any questions or comments? Yes, Eric, you're recognized. Please.
One of the things was brought up is that, the Cigna switching over is, there's uncertainty there. I've been through a lot of these over the last 30 years, and it's really not that big of an issue. Secondly, Humana not having a guarantee on a price for the future is really not that big of a deal either, because Humana characteristically does not have huge jumps from year to year to year. They're somewhat predictable. So if anyone had those as concerns, they're really not that big of a deal.
Thank you for that. Those were appropriate comments. Very much. Any other questions or comments? Seeing none, without objection, call the roll, please.
Commissioner Boyd, Amber Brown, Mike Curtis, Holly Deering, Brian Gaither, Mary Hickerson, Lois Miller, Commissioner McAdoo, Jennifer Schmidt, Michael Smith, Steve Spence, Sonia Stevenson. Eric Tutobeni.
Motion passes. Is there any other business? Ms. Mary, you're recognized.
Okay, so with that being said, and that we're sending on for Humana, for the people in the audience and those of us who don't understand it completely, Ms. Marissa, would you please explain the difference of the Humana plan, Medicare Advantage, that you see on the television, that if you talk to some doctors and nurses, they're like, oh no, it's awful. So could you explain the difference in, I believe you referenced it earlier, group benefit?
Yeah.
I may not use those words right, but could you
Sure.
ease our mind as to Humana on the television and Humana, how it is offered to groups like ours, please, ma'am?
Just for the record, yes, please, Marissa, do that, but realize, committee, that the committee has already taken a vote, and we're not discussing the aforementioned vote unless a member of the committee wants to make a motion to reconsider their action. So that matter is concluded, so this is nothing more than an explanation. Marissa, you're recognized.
Okay. So one of the areas, to answer your question, they're completely different because one is procured by you as a group employer sponsor of the plan. And so on a group basis, you get to go to the market and purchase something that you then also get to sit in the center of in terms of service and administration. That is very different than like my mom, who's over 65, going individually, because she didn't have this through an employer as a retiree, and buying a supplement that she has to navigate those waters all by herself and figure out what plan works best for her and, price shop it and do all the things within the deadlines to get it, all the things that are so scary at the time of entry. And then as the claims happen, a good example of that would be like your skilled care, nursing home type situations. A lot of times when you're in an individual supplement, you don't have quite the assistance that you do when you're on a group plan with getting those things all lined up. So that would be one quick example of what we were talking about, but certainly both on the administrative and the service side, they're very different animals.
Mary, was that satisfactory? Yes, sir. Great. Any other questions under other business? Ms. Combs, thank you. Smith Combs, thank you for that wonderful explanation. Our next meeting is May 29th, 2025. If there is no objection, we are adjourned. Thank you.